Hello everyone, this is Patricia from Mental Health Matters. We're going to talk today a little bit about bipolar 2. Last week was bipolar 1, and for those that are following me, you know we've talked about major depression as well as low-grade depression, which was brought to the public awareness, I think, by our first former lady, Michelle Obama. So bipolar 1, bipolar 2, what's really the difference? Well, there really isn't much of a difference between the two except for the severity of the two. Both mental health concerns have a high called a mania and they have a low called depression. The mania usually is very elevated. It can last for weeks into months. It is where the brain is really racing with thousands of thoughts coming at one time. Their speech is very fast, very pressured. They usually have insomnia, they can't sleep, they're very restless, and the list of those symptoms go on. Depression, on the other hand, is the downside of bipolar 1 and 2. It means that the person really can stop functioning in the world. They can't get up for school, they can't really do a job well, they have high irritability, easily agitated, and this too can go on for several months or even years. Many years ago, I'm talking, 20, 30, 40 years ago, people were not diagnosed with bipolar 2 because it wasn't that severe and it certainly wasn't that obvious. They were considered highly functioning people. They held jobs and they stayed in their families and they went to school and they performed all of the things that were necessary. But during those periods when this disorder would get activated, usually triggered by chronic stress, the individual would then seek some way to cope. And alcoholism was very prevalent, as well as drug use, anything to bring them up when they were depressed, and certainly to help them sleep and come down, help them when they were depressed. In those families, there was a noticeable amount of dysfunction. The individual, whether it was a parent or not, would often be very agitated and irritable. He may become physically or emotionally aggressive with his children, with his wife. Relationships were very hard, and there was a lot of emotional, mental, and physical abuse within the family. They didn't know what was wrong during those years. Today we do, and that is the good news. So bipolar 2 has the same signs and symptoms. It's really no different than bipolar 1, except with the length of it and the intensity or the degree of it. In bipolar 1, most patients at some point may go psychotic, which means that their mania is so high it has broken through all the barriers in the brain and they are out of reality. For example, they think they can fly, and so sometimes they'll go to heights and think that they have the ability to do that. It can be very, very dangerous in a psychotic episode and usually involves a hospitalization. And speaking of that, a lot of physicians and psychiatrists will ask the family, how many times has the patient been brought into an ER room or to a hospital? That usually is the deciding factor between bipolar 1 and bipolar 2. Bipolar 1s for sure are usually in a hospital setting much more often. Bipolar 2s can seem to function in the world. They're not happy. They don't know what's wrong. And as I said earlier, a lot of the factors in their home life and in their workplace, in all of their relationships, are suffering. So we take bipolar 2 just as seriously. It needs two things: medication and psychotherapy or support from a therapist or a social worker. When the first episode happens and they're teenagers, one of the biggest problems we have with our bipolar patients is keeping them on their medications. They like the feeling of being high, and it takes a lot to break through that denial that they need their medication. The most typical and used most often is probably lithium. From there, some of the other mood stabilizers could include Depakote, which has had wonderful outcomes, and Lamictal. And on, the research and on that front, pharmaceuticals are always looking for new ways to help balance out that brain so that the individual isn't constantly going through a cycle. And speaking of cycles, there usually are seasonal cycles for both bipolar 1 and 2, in which sometimes the individual goes high in the spring and summer, and sometimes the winter and the fall are more on the depressive side. So we know that this mental health condition runs in families. You may be born into a family with a parent that has bipolar 1 or 2, and you're going to have a vulnerability to the disorder. It doesn't mean that you can't manage it. It doesn't mean that you can't go on and live a fulfilled, happy life. It just means you have a predisposition to land in that kind of mental health condition because of the genetics. Also, we know the home environment plays a big role as well. So that is the difference between 1 and 2. It's the severity. The Mayo Clinic has come out and said that the depression in bipolar 2 does last longer. And when I'm saying longer, it could be months, and in some cases even, years without treatment. And unfortunately, many people suffer that way. So this informational video, this video to inform you and to educate you, is for anyone that you may know, anyone in your family, any loved ones that may be suffering from these mood swings, this mood disorder, to get help. I think that is my message for all of mental health. I want people to not be afraid to go seek help. There's so much available, so much good information, good doctors and therapists and social workers, and today medication that can help your life stay balanced and not have these severe mood swings that really are so disruptive and so painful. Next week, I'm going to touch a little bit on the postnatal depression that is very prevalent when women give birth afterwards. And I also want to talk to our families about depression and what they can do to help cope better and to give them some tips about how to deal with a bipolar or a major depressive family member. Because this takes a tremendous toll on families and on loved ones. And you can only imagine that with the high irritability and the easily agitated person, it's really hard to communicate and to share your feelings and your concerns with them. Denial is very prevalent in bipolar 1 and 2. They don't want to believe that they have this condition. So it takes a lot of time and patience and understanding to make a breakthrough, and then to get them on the right diagnosis and with the right medication. So families are definitely affected by all of our mental health conditions, and they also need help. So again, if you know anyone that would benefit from this very brief video, I could talk about bipolar for a long time, but I won't. Next week, we'll touch a little bit on some new coping skills for families and talk a little bit about that postnatal. So I hope to see you next week on Thursday. Again, this is Patricia. Please leave any of your comments or any questions that you may have down below. I'd be happy to answer them for you. And I look forward to seeing you all next week. I hope we all have a great week. Thanks for listening. Patricia with Mental Health Matters. Thanks so much. Have a great week, everyone.